Hello. As we can't be with you in person, we have recorded the following video to walk you through a demo of our breast positioning and image quality assurance solution, Mia IQ. Chiron is a leading applied science company transforming cancer diagnostics through the power of deep learning. Clinical rigor, not hype, is our motto, ensuring our solutions support radiologists to confidently detect cancer. To achieve this, we focus on a targeted clinical domain and go deep. This allows us to understand the real-world data, the challenges, the diversity in patients and workflows, the equipment, and the priority outcomes that matter to clinicians and patients. In other words, we take a problem-first approach. We are starting with breast cancer, and our award-winning AI breast screening solution is called MIA. MIA, which stands for Mammography Intelligent Assessment, is our suite of AI solutions for breast screening. MIA is designed to empower radiologists and screening services to deliver confident, accurate, and timely results to any woman, anywhere. In this presentation, we'll be focusing on the next solution in the MIA family, MIA IQ, our AI-enabled solution for breast positioning and image quality assurance. Despite the success of the MQSA in improving and standardizing the quality of mammograms, poor positioning remains the most common reason for technical failure of American College of Radiology, or ACR, clinical image quality reviews, and accounts for almost half of all technical recalls. Evidence also suggests that these issues are responsible for delays in diagnosing 22% of screen-detected cancers and 35% of interval breast cancers. Failing to properly position the breast can result in only parts of the breast tissue being fully visualized, making it difficult or even impossible for the radiologist to detect or fully exclude the presence of malignancy. This can have real and devastating consequences for women, as demonstrated by the case on your screen. There are a number of challenges related to breast positioning and image quality that screening services currently face. These include missed cancers due to positioning errors, poor patient experience and increased anxiety associated with technical recalls, leading to a potential loss of trust for screening providers, audit compliance and the burden of preparing for an external audit such as MQSA, and finally, the risk of potential unnecessary excess radiation exposure from repeat exams. The automated outputs standardize the assessment of mammograms for an imaging center or across multiple facilities. This enables screening services to identify image quality issues, allowing them to take proactive, corrective action, develop relevant training for their center, and drive continuous performance improvements for mammography technologists. MIA IQ is ultimately designed to reduce technical recalls, which are expensive, a duplication of resources for screening providers, and also a source of unwarranted anxiety for women. MIA IQ also helps to ease the administrative burden of preparing for external audits such as MQSA Equip. MIA IQ integrates seamlessly into your existing workflow. Once studies have been acquired, they are then sent to the PACS, where DICOM studies are anonymized. They're then uploaded to the cloud in batch and analyzed by MIA IQ. Analytics reporting of these studies will then be available to view via a web browser. Trained to recognize the key structures of the breast, MIA IQ segments the image before assessing the position and shape of the key anatomical elements based on standard principles of ideal image positioning. After evaluating all 4 standard digital views, MIA IQ provides an image-level decision of whether a case is adequate or inadequate based on the agreed criteria. This helps the technologists continually learn and improve their positioning technique, ensuring that the breast is fully and appropriately visualized, giving the radiologist the best chance to identify early signs of breast cancer. By automating the analysis of core image quality criteria, MIA IQ helps to reduce subjectivity. On your screen, you can see an example of many of MIA IQ's evaluation criteria. This can include skin folds, overprojection or artifact, whether the IMF is missing, whether the breast is centered on the table, and that the nipple is in profile. This criteria is designed to meet audit guidelines, but can include additional criteria from the MIA IQ menu, specific for your institution and clinical needs. Providing MIA IQ as a quality assurance tool supports your technologist in delivering the best quality images for your radiologist to read, and therefore helps to avoid unnecessary technical repeats and recalls. Even greater effectiveness comes from combining Mia IQ with an AI-based radiologist reading support solution, such as Mia, enabling the radiologist to provide results more confidently, efficiently, and effectively. Ultimately, the combination of Mia IQ for image quality assurance and Mia as a reading solution, along with the radiologist, will deliver better outcomes for your screening services, such as higher cancer detection, fewer unnecessary recalls, and a better patient experience. I hope this presentation has shown you how Mia IQ can lay the foundation for your screening service. If you would like any further information on Chiron Medical or Mia IQ, please get in touch via the email address on your screen. Thank you for your time.